Good morning, everyone. My name's Judy East, Bureau Director for Resource Information and Land Use Planning at DACF. I'm with my co-chair, Becca Boulos, from the Maine Public Health Association, and I'd like to acknowledge that our third co-chair, Annie Fuchs, was not able to be here today. She took over halfway through from Sam Roy, who started out as our co-chair when he shifted from MEMA over to USGS, so thanks to Sam for that launch. I'd also like to recognize the staff that helped us out, Coastal Fellow Rachel Hamilton, Climate Change Specialist Nathan Robbins, and Senior Climate Planner David Ludwig, and our extraordinary facilitator, Melanie Garate. Thank you so much, Melanie. Okay. This is our working group. You'll notice that it is very large and very well qualified. They were also extraordinarily well engaged. Our process was to start with a survey across all of the members so we could scope out where we would focus our work. We ended with a survey as well once we had our final recommendations to review what we had prepared and to fine-tune, ensure we didn't lose anything. In the middle, we broke into about 4 subgroups, each one of which would present to the working group to provide us all a foundation of the same substance. Their preliminary recommendations, we had back and forth conversation about those recommendations. The subgroups went off, refined those recommendations, then that final survey fine-tuned them, and then we pulled them all together. The amazing working group that we had, just absolutely phenomenal engagement. This is a summary of our recommendations. I would say that 1 and 5, that is empowering local and regional efforts, and the funding issue are really a reboot with additional recommendations from before. Number 3 and number 6, that is establishing a metrics framework and looking at the impacts of mental health from climate change are new this time around. The enhancing of state and local abilities to assess climate risks, I won't read that whole thing. That's also a new effort for better integration. And then number 4 there, improving information and education. I would add the words engagement and communication. Those topics and concepts run through all of our recommendations. So digging in a little bit first on the empowering of local and regional resilience efforts, the full spectrum we're referring to here takes you from avoidance, protection, adaptation, and we also added retreat this time, and I'll get into that in a little bit later. Capacity issues we talked about across multiple levels, the need for data. Some of these things are pretty obvious. Avoid development in high-risk locations, consider climate risks with infrastructure decisions. The devil is in the details. Our report is 56 pages long. I highly recommend you take a look at those. I'm not going to go into each one today. Obviously, there's recommendations around data, and we do advance nature-based solutions. Looking a little more in depth at this enhancement of state and local and regional abilities across the spectrum, again, assessment, preparation, recovery, and adaptation. We have recommendations around assessments, especially in recognition of some of the things that we encountered with the disasters of this past winter. There are multiple public health risks that we speak to, issues around infrastructure improvements, and this area of getting out of harm's way, that's the retreat strategy across the spectrum, which brings up emotional, financial, fiscal, historical, attachment issues to place that is incredibly fraught and complex. We have recommendations around skilled facilitation to address those issues, as well as exploration of a voluntary buyout program. I'll just point out the enhanced hazard mitigation, planning, response, and recovery. All those commas and the "and" make a difference because we have a multitude of recommendations around better integration of those who do resilience planning with those who do emergency management planning and response. And before I pass to Becca, I'll just mention that we recommend establishing a framework for the metrics of how well we're doing, and that the references in our document are extensive across all of our recommendations. The metrics will probably run with cross-cutting to other of the working groups. They obviously adjust over time, and there are in those references state and national examples that we can go from. Over to you, Becca.
5 minutes and 5
seconds.
Oh, you did so well. Thank you, Judy. That was very well done. So in the context of improving information and education about climate and health, our broad strategy really is about improving the quality of public health data, as well as our response to those data across the state, so that we improve our capacity to appropriately identify and address emerging climate-related issues. We also aim to increase awareness and understanding of those issues and to make sure that people have equitable and easy access to the resources they need to respond. As an example, we want to raise awareness about the increased risk of mold after severe weather events like the most recent back-to-back storms, and make sure that people know how to either remediate on their own or access affordable services in a reasonably timely manner. In the context of expanding access to funding and financing for climate adaptation and emissions reduction, the broad strategy is about developing a comprehensive, multi-pronged, and long-term funding plan and investment strategy to support the implementation of Maine Won't Wait. And that includes how to make funding opportunities more efficient and more accessible for more communities, and maximize opportunities for federal investments. In this strategy alone, we provide 17 recommendations, so there's no shortage of ideas for the Climate Council to consider. In the context of increasing awareness and action on the mental health impacts of climate change, the broad strategy is about recognizing, uplifting, and responding to the mental health impacts of climate change through increased resilience, hope, agency, and community connectedness. More specifically, we recommend the establishment of a climate psychology task force, which can help inform multi-level investments and comprehensive training and resources for people across the state, including first responders and healthcare professionals, and especially for those who are most impacted by climate change, including youth. Through the University of Maine Mitchell Center's Equity Engagement Project research, this quote was captured from one of the participants. Quote, "When asked open-ended questions about their most pressing needs, survey respondents do not cite climate change, but nearly always point to challenges that are related to climate, such as high fuel costs or competing challenges such as a lack of childcare," end quote. This very much matches conversations we had in our working group about recognizing and endeavoring to respond to other determinants of people's health, especially for populations most impacted by climate change and with the least resources to respond. We discussed how our proposed strategies can also include improvements to processes, like funding applications, which can serve as a barrier, but really should serve as a facilitator for people and communities to get the support they need when they need it. These are examples of other competing priorities and barriers, including the cost of living, transportation, funding, and disillusionment. For us to be successful at supporting the people most impacted by climate change, we have to consider these other determinants of health. This is where intentional, collaborative, cross-sector work, both within state government and with external partners, particularly with impacted communities, is important. And lastly, I'll just reiterate, as Judy mentioned, we have a very comprehensive report with many more ideas, including a lot of references, with a table of contents. You can click through and see what you want to read. So please do take the time to do that. And I have 52 seconds left, so there's that.